everyone, welcome to Healthy Mondays. This is Dr. Maha Wakarbek and you are watching Versatile Maha. So today's topic is a little serious and a little deep, and what makes this condition so important is that it is also known as a silent killer. So the condition which I am talking about is none other than diabetes mellitus. So a very common problem, and according to a survey in 2019, prevalence is 9.7%, that is roughly 10 out of 100 people. So as we all know, it is a very common disease and it is becoming more common day by day. So guys, there are certain important facts which I'm going to tell you about diabetes. It is a vast topic in itself, so I'll just take 10 points here and I'll be a little fast so that the video I could cover most of the things in a small span of time. So be attentive throughout the video and do watch it till the end so that you know exactly what to do and what not to do. So guys, before we start with point number 1, let me introduce you to a new word that is called fidato. Fidato is an Italian word which means someone you trust or a trustworthy person. So why am I telling you this is because in every household, usually there are the elderlies who are diabetes because type 2 diabetes is more common, and there should be one person who should take care of their elderly, one person who should maintain a diary and keep the record of their last checkup, their annual checkup dates and everything, their calorie intake, their diet chart should be there in a particular diary, and that should be the responsibility of one person, one responsible person in the house, one trustworthy person whom I've named fidato. It could be he, she, anyone. So let's start with point number 1. In point number 1, we should know what are the normal values and abnormal values of blood sugar. So in this chart, we can see FBG, that is fasting blood glucose, PPBG, that is postprandial blood glucose, and RBG is random blood glucose. So normal value for fasting is 80 to 100 mg per dl. Impaired glucose or pre-diabetic value is 101 to 125 mg per dl, and diabetic is 126 above. For postprandial, the normal value is 170 to 200. Impaired or pre-diabetic is 190 to 230, and diabetic is 220 to 300 mg per dl. Random blood glucose, again 120 to 140 mg per dl is normal. Impaired blood glucose, or in a pre-diabetic person it is 140 to 160 mg per dl, and in a diabetic person it is more than 200 mg per dl. Postprandial is more sensitive as compared to fasting blood sugar. Let's come on to third point, that is HbA1c, that is glycosylated hemoglobin. So HbA1c is the most accurate and most specific form of test for glucose, and the values are as follows. In a normal person, it is less than 5.7%. In a pre-diabetic person, that is an alarming rate, it is 5.7 to 6.4%, and in a diabetic patient, it is 6.5% or more than that. So the second point is the frequency at which you should get yourself checked. So firstly, every diabetic patient should have a glucometer at their house. And how frequently should you get yourself checked with glucometer at your house? It is at least 2 to 3 times a week. It should be fasting blood sugar at one point of time. You woke up in the morning before taking your medication, take your blood sugar level, and if it is less than 126, then you have a good control. And apart from that, on the same day or next day, you can have postprandial blood sugar. You've just had your meal. You can again take your blood sugar level. And also, if at any point of time you feel a little dizzy, you feel uncomfortable, then you do not have to neglect it. Even if you have checked your blood sugar the same day, you should again check it at that point of time, because it might be hypoglycemia, and hypoglycemia means decrease in blood sugar level, and it should below normal levels, that is less than 70 milligram per dl. If it is less than 70 milligram per dl, you do have hypoglycemia. So this is how frequently you should get yourself checked at home with glucometer. Now, how frequently you should get yourself checked at the lab or at hospital? That is 3 times or 4 times a year, right? Because HbA1c, like I already told you, it tells you how well you've controlled your blood sugar level in last 3 months. So it's better if you get it checked every 3 months in the lab or hospital. And now once you're going to the hospital or a lab and you're getting yourself checked for blood sugar, you should also get checked for blood urea and blood creatinine, right? Because it will tell you as to how your kidneys are functioning, because diabetes does affect kidney later on. I'll come to that later. And apart from that, you also need to get yourself tested for urine, get your urine culture and your urine routine microscopy to look for some albuminuria and culture and sensitivity, because most of the women, they tend to develop UTI, that is urinary tract infection, and diabetes, so they need to check for that as well. So this is point number 2. So let's come on to the third point, and the third point is diet. Now, diet is the most important aspect of diabetes. So here is a list of food which every diabetic patient should and should not consume. Now, since every patient has a different body mass index, so dietary requirements are also different for them. So I would suggest that the diabetic patient should go to their dietitian and get their diet chart formed and strictly adhere to that diet chart. Definitely, if a person is diabetic, sugar intake, there's no question of taking in sugars. Carbohydrate should also be controlled. Fat can be taken, but in a certain amount, and that varies from person to person. Lean protein should be taken, but that will again vary from person to person. And again, take a rich, fiber-rich diet. And a lot of people think that there are certain types of food which will cure diabetes. It is a myth. Fenugreek seeds, people think that fenugreek seeds will control their diabetes, will cure their diabetes. So let me tell you guys, I'm being very blunt, it will not cure your diabetes. So you do not need to be overconfident that because I'm taking certain amount of food, so I will not take my medicine. That is completely wrong. You cannot adjust your dose according to yourself. If you think that you're having a good control on your blood sugar level, then you need to go to your doctor, consult your doctor, and only then you can get your dose adjusted. You can't do anything on your own. So let's come on to point number 4, and that is your lifestyle. So like I said before in my last video, I told you guys that lifestyle plays a massive role in all of the diseases, especially our sedentary lifestyle, the kind of lifestyle we are living. It is going to cost us a lot in the long run. Now the reason, stress plays a big role in causing diabetes. So you need to release your stress, relieve your stress. You need to sleep a lot, do whatever you do for busting your stress. And for that, not smoking or taking alcohol, because again that is detrimental. You need to relax yourself, you need to calm yourself, you need to meditate yourself, you practice yoga, wake up in the morning, follow a strict routine, discipline yourself, exercise a lot. Even those who are affected by diabetes, they are advised a lot of exercises. So this was about your lifestyle. Let's come on to point number 5, and that is overconfidence. Do not be overconfident. There are a lot of diabetic people I've seen who are so overconfident in themselves. They're like, oh, we'll see, whatever will happen, it's okay. It's just one party, let's relish this time, and this moment will never come back. You live only once. Life is short, this and that. These are all, you're just fooling yourself. You're not fooling anyone else. You need to be true to yourself. There are people, we've left it to fate. Okay, upar wala dikhega, jo hoga. It is not in our hand to die or live. It is God who looks after everyone, right? But again, this is an overconfident attitude. God has given us brains to think. This kind of attitude, this overconfidence, it won't affect anyone but you. And the worst part about diabetes is that you won't die the very next day. It becomes painful, right? In the form of small complications, which I'll come to later on. So now let's come on to point number 6, and point number 6 is heart diseases and diabetes. So heart diseases and diabetes, it's a lethal combination, and it's very sad that a lot of diabetics, that is around 33% diabetics, tend to develop heart diseases, right? That is, out of every 10 diabetic people, every 3 people might have heart diseases, right? So heart diseases, which usually manifest in the form of ischemic heart disease and stroke. So what you need to do, again, this is where your diet plays a major role, your lifestyle plays a major role, and smoking. Because if you guys are not taking care of yourself, not disciplined at all, and if you're smoking, you will end up having a heart disease in the form of stroke or ischemic heart disease, right? So apart from a good control, what you need to do is you need to get yourself checked. Like I said about HbA1c, you need to do it 3 or 4 times a year. For this as well, I would say 2 to 3 times a year, you need to get your lipid profile done. What is the status of your lipid profile, and again your ECG, right? So once you're going to get yourself tested for HbA1c, you should also go and get your lipid profile checked and get your ECG done. And while we're talking about that, at least once a year you should get your echocardiography done, so that if you're going to develop any sort of cardiomyopathy or anything, you will come to know it as early as possible. So let's come on to point number 7, that is eye, complications in eye. Complication could be in the form of first cataract. You could develop cataract, that is because of diabetes. You could develop glaucoma, and the most detrimental, retinopathy. Retina, that is back wall of your eyeball. And retinopathy, again, if you develop complications in retinopathy, then it will result in blindness, which is an irreversible change. So it is mandatory for every diabetic patient to get an annual eye checkup done so that if at all he or she may develop any eye symptoms, it could be handled beforehand. That was point number 7. Let's come on to point number 8, and that is diabetic nephropathy. Now, what is diabetic nephropathy? Nephropathy means affecting your kidneys. What you need to do again here is that you need to get your annual renal scan done. And like I told you in HbA1c, while you're going for HbA1c, get your urine test done, get your blood urea creatinine so that you'll keep knowing what is your status, what is the status of your kidneys, right? And because urine again, you'll see the loss of protein in the form of albuminuria. So that ways you'll know how your kidney is working. So that was point number 8, and now let's come on to point number 9, and that is diabetic neuropathy. So diabetic neuropathy is again an irreversible change. Once it happens, then there's no going back. And symptoms are tingling sensation, numbness in feet, burning sensation, and while patient is walking, sometimes when they're halfway through, they realize that they do not have the slippers on anymore. So people who do develop diabetic neuropathy, they need to be very careful. They need to do regular examination of their feet, and they need to make sure that they have not hurt their feet, because there's no sensation over there, so they won't realize if they would have hurt their feet or not. And now let's come on to the last point number 10, and that is hypoglycemia. Now hypoglycemia, like I told you earlier, it is decrease in sugar level than normal, that is less than 70 milligram per dl. And hypoglycemia is the most important thing in a diabetic patient, because hypoglycemia is one thing which can kill the patient. Excessive level of glucose will not kill the patient immediately, but hypoglycemia is the reason for killing or for death of the diabetic patient. And such a basic thing, the treatment is as simple as just giving a solution of sugar. So what happens now, let me walk you through it. Now if a diabetic person all of a sudden complains of dizziness, and then finally suddenly the person becomes unconscious, you'll have to think that the person might be getting hypoglycemic. And it is usually seen in patients who are insulin dependent, like in patients who are type 1 diabetes, or patient who are in type 2 diabetic patients and on insulin therapy. So what happens once you've taken the insulin shot and you've forgotten to eat something after that, you've forgotten, like suppose if you've got an insulin shot at hospital, and then you think that okay, I'll eat something at home, and then you reach home, you forget to eat, and then all of a sudden the person will feel dizzy and the person will collapse or become unconscious. So hypoglycemia is very important factor. It's very important thing which can kill a person. So people who are on insulin need to be extra careful about hypoglycemia. They need to get their food as soon as they take a shot of insulin. So what happens if a person is unconscious in front of you? It is the responsibility of Fidato here that person will suddenly, he or she will check the glucose level of that particular person, take the glucometer and see what is the sugar level, and suppose there is no glucometer at that point of time, you will have to consider it as hypoglycemia. If a person is unconscious and the person is diabetic, you do not have a glucometer, go with hypoglycemia. Because what you'll need to do, you'll just give a sugar solution, and if you're outside in a market or something, buy a packet of juice or anything, a cold drink or whatever, feed it to the person, and the response is magical. The person will just sit and the person will be fine. And suppose if a person is, take for instance that a person has fainted because of hyperglycemia, which is very rare. But if it was hyperglycemia and suppose the sugar was 500 milligram per dl, and you've again given the person sugar, so what will happen? Worse come worse, the sugar level will hit 600, but again the person will not die. But if you won't timely manage hypoglycemia, the patient is definitely gonna die. I have seen a lot of diabetic cases who were on insulin and they have died, they have collapsed because because of hypoglycemia. They couldn't get the proper management at that point of time. So that is the importance of hypoglycemia, and every diabetic person should know the management of hypoglycemia. So this was point number 10, hypoglycemia, and these all were the points of diabetes which I wanted you guys to know. We all need to discipline our life, our sedentary lifestyle, to prevent diabetes, and if at all we develop diabetes, to prevent the complications which I just listed above. So that's why it's called a silent killer, and that was all about diabetes. I hope you guys learned something from it, and if you guys did like the video, give it a big thumbs up, hit the like button, and don't forget to subscribe to my channel. I'll see you in a few days with some light fun video, and that's it from my side. Take care, you guys. Bye the byes.